Alright guys, it's Dr. Reese here. I'm going to take you through the training checklist for the clinical assistant. I'm going to systematically go through the top to the bottom, and I'm going to start off with all the orthodontic instruments in our repertoire and what we use and what it looks like. And then I want you to learn how to spell it so you know exactly what it is. I'll include the names in a checklist form with all of the correct spelling at the end of this video, or alongside it depending on how the edit goes. But let's start off with the first thing that I've got on the top of my pile is what we call a placement gauge. I don't necessarily use this, but it's in our equipment drawer, so you may see it and wonder what it is, but these numbers are just reference for me when I'm placing brackets. Don't really use this very much anymore, but some people do, but it's there regardless. The next thing we have here is a mouth mirror. This is my tool of choice whenever I need to look at the mouth. The first thing I'm going to ask for is the mirror. I can't see what's going on inside the mouth without it. So when I'm coming to the chair or you're coming to grab me, you need to have the mirror unpackaged and ready to hand to me so that I can grab it. So real quick side note right there, when you're handing me an instrument, you need to hand it to me so that I can grab it and not have to readjust my hand or my instrument. So don't hand the instrument to me like this, where I have to grab it like this and then go back like this to use it. You're gonna hand the instrument to me like this so I can grab it like this and use it. So keep that in mind as you're handing me the instruments. You're gonna hand them in a way that kind of seems weird to you, but it's so that I can just grab the instrument and look at it and not have to resituate my hands or the instrument. This is the mouth mirror. It's the first instrument I'll ask for when I'm looking at someone's mouth or a patient's mouth. So please always have this ready to go. There's the mouth mirror. The next instrument that you're going to use quite a bit is called the Explorer, a dental explorer. We have several variations of these inside the clinic. We have here in El Paso, our Explorers are pretty pointy. In the Alamogordo clinic, they're a little blunted. Pros and cons to each. The blunted one is more safe. You're not going to poke someone's gums. However, it is a little more difficult to remove otites and get underneath the otite. With the pointed one, easier to get the otite off, but also more dangerous, meaning you can poke the patient or yourself. Regardless, don't put your finger in the way when you're using this, and don't poke yourself. These are the cotton pliers. If you have your gloves on and you're trying to grab something inside the drawers next to you, like a cotton swab or whatever you need, you can remove one glove and then use this to go in and grab the materials or things you need and put them on the treatment tray. So these are the cotton pliers. What they look like. This is a spatula that we use to mix the glass ionomer inside the band when we're fitting an appliance into a patient's mouth. The band could be isolated by itself. Sometimes if we have a bracket that we just can't get to stick to a tooth, we'll put a band on, and we use this to mix the cement because it's a powder. It comes in a powder and a liquid, and then on a wax mixing pad, you mix it, and then use a spatula to kind of fold it, and then use it all, and then use the spatula to pick it up and put it inside the band to be cemented. So this is only used when I'm cementing something with the glass ionomer. This is called a band pusher, or a bite stick. It's a little stick that kiddos or somebody can bite onto that will help me push and position the band in the mouth properly. You can use either end. The idea is to get the band around the tooth without bending the band and ruining the band. And so you don't want to have someone just bite willy-nilly on some random corner. You want to try and massage it or kind of like situate it around the tooth and then gently push it in this way. So I'll make a video on that eventually. Here is how the instrument that we use to remove appliances or remove bands. It has a unique little feature right here where I have like a little plastic stub right there and the little pincer part right there gets underneath the band. So this little metal finger right here, so I can separate that for you. That little finger right here gets underneath the band, and then you squeeze the appliance. You use these pliers and squeeze the band off the tooth. And you wiggle it, you kind of work it from one side and the other. Don't just pull it off on one side. You kind of wiggle it both back and forth. But anyway, that's what this is called. This is the band remover. The next instrument that I use is called a three-prong plier. Three prong just gets basically like this, like my fingers right here. I use that to bend wires and whatnot. There's different variations of this. I have a thick one, I have a thin one. I don't like the thicker ones. They're hard to get in the mouth and get to the small areas I need to get to. This is a thick one. I have a few thinner ones around. Usually if there's a choice, grabbing the thinner one. This is called a tweed plier. It's a bending plier that I use to situate the wire and make bends in the wire so that I can fine-tune the adjustment of the teeth. It's got this little half-moon shape to it. Yeah, like that. It opens up like this. There you go. Like that. And by the way, the tweed pliers are used for end game, orthodontics at the late stage where I'm just fine-tuning things. I don't usually use this until they're in bigger wires. This plier is called a math-out plier. It's your bread and butter plier when you're putting oak ties or power chain on. It allows you, these little fine pincers allow you to grip onto things and hold it tight. It will use a little locking mechanism that's situated right here. That the only way to activate it is by clicking it, and to unactivate it you got to further clip the plier and it'll bounce back. This is how you put oak ties on and power chain on. We'll go over that. It's called a math-out plier. This is called a Weingart plier. This is your plier you use to insert wires, or usually just insert wires. If you're putting a wire into a 7 or a 6 bracket, it's hard to get back there and grip it. These pliers are angled so that you can go through and insert the wire at an angle in the back of the mouth. This is your go-to plier. So whenever you're inserting a new wire, you're going to use a math-out plier. Sorry, a Weingart plier. This is called a distal end cutter. It's got a little spring mechanism right here. Right, that metal rod right in the middle is a spring finger that holds the wire down, so when you're clipping, it'll grab the wire and not fling into the patient's mouth. These are perfect pliers if someone's got a little bit of a wire that's poking out of the bracket and they can feel it, you can't get it out. This is the best way to get it out, or get the little pointy piece off, so keep that in mind there. This is called a step plier. The reason being is because it allows me to make step bends, or a bend inside the mouth on a wire. It's like a stair step inside the plier mouth. I use these to make intraoral bends without removing the person's wire, the patient's wire. So I'll ask for these as well late game when there's a steel wire or a thick wire in it. They come in 3 sizes, small, medium, and large. They don't say on the plier which one's which. You just have to look at the step and see if it's bigger than the other one. And use your best judgment. And I'll usually tell you, I'll tell you if I need a bigger one or smaller one. And this is called an arch forming plier. It's got like a semi-moon or semi-lunar kind of like mouth to it. Right there, if you can see that. I use this when I'm doing lab work to kind of make retainers and things, so you don't have to worry too much about that one. I'll be grabbing that by myself. This is called a loop forming plier. Has 3 cylinders right there that constitute the plier that allow me to go through and bend loops that are various sizes. I do use this plier when I'm making loops or bends to bring in an impacted canine. Yeah, so there's that. I use that quite a bit on that. So if you have an impacted canine, beware of this plier. This right here is a wrench or a driver. Basically, it's a driver to put little springs on people's mouths if they're not compliant wearing rubber bands. I'll resort to that. I don't use this too much, but it is in the bag there. So if you see that, that's what it is. Now this plier comes in a set. So it's an anterior torquing plier. And I only use this when I'm trying to, go through and add torque to someone's teeth. So let's see if I can show you this here. So this one's like hollow in the mouth right there. You see that? So it goes on the outside. And this one fits inside like a lock and key. Anyway, they come in a set, so it's anterior torquing pliers. That's what these are right here. So, and then I have another loop forming plier. This is for making hollow retainers and whatnot. So you can see that. I don't ask for this too much, but that's what that is. Now these are included in a bonding setup. So this right here, this little instrument that looks like a little L shape right there. It's kind of like a knife shape looking thing. Has one over here, opposite way. This is for placing brackets. I use this, it's called a Hollenback. And I use this to position brackets once they're on the teeth. And these are different types of pliers right here. The middle one is for placing like anterior brackets on the teeth. And this one on the far side is for placing posterior brackets on the teeth. And the reason being is because this one kind of you put the bracket in there, you can reach back in position on the 6 or the 7. And this one's more for like the 3 to 3 region, but these are bracket tweezers, different designs for different purposes. The longer ones are usually for the posterior region, and the middle one, shorter, is kind of for the anterior region. This plier right here is for bending the nite wire, like a 16, 14, or 12 nite, or even an 18 maybe. What you do is when the wire is being has been clipped, and to make the patient feel comfortable, the wire needs to be bent from a straight edge like this to more of an angle like that. And that way the wire's not poking them out in the middle of their cheek, it's pointed towards the tooth. And this is how you do it. This is with this plier. So I'll show you how to do that later, but this is that plier. It's called a nite cinching plier, or cinch back plier. This plier right here is for removing brackets. It has these little teeth with a little round circle in the middle, like that. You can see it or not. And the way this works is you go through and you grab the bracket and you squeeze the bracket or the plier together, and the teeth don't come together. They don't come together all the way. They're separated just enough to make the bracket pinch off the tooth without actually snapping into the bracket. So that's what this is for. And this is another form of a distal end cutter. This is a non-flush cut, so whenever you cut the wire, it's going to be a little bit long. It might poke the patient, but depending on patient preference, if they're really picky, they may want to have a flush cut. So there's no point at all, but generally, by and large, this is sufficient for what we need. So there you go. Those are the instruments. The next thing I'm going to do is go over the different materials that you'll find in our clinic. Actually, I have a few more things. I take that back. I have one more plier right here, or one more instrument here. This instrument is for opening the Pitts brackets. Now, Pitts brackets have a little door on them, and so this instrument right here is used for opening the door, and you insert it like this and twist. So if you can see that, you're kind of going like this and twist. But this is what this is for. This is for opening the pits brackets like that. So when it's all sterilized, we put it back in the sterilizing pouch, but this one hasn't been done yet. There's that. And then I have, these are called IPR disc. IPR stands for interproximal reduction. When I need to go through and slenderize some teeth, I'll ask for a slow speed handpiece and some IPR discs, and this is what they are. They come in different forms. They can come in different sizes. You have bilateral IPR ability, meaning one side's or both sides have diamond materials on, so you can grind both sides of the tooth. Or you have one side that's not, it's just kind of plain, and that's how you just kind of have a more controlled thing. So I'll have a one-sided IPR disc or a double-sided. That's how you kind of get rid of that. So, and then I have some different burrs here. I'll get these out here real quick. So this burr right here, zoom in on it a little bit, is a diamond burr that I use to remove cement off of a tooth that's got a lot of cement on it, or like a bite turbo or something like that, where I've got to be kind of aggressive. I'll use a diamond burr. This is my favorite one. If I'm retouching the tooth, I'll use a mosquito burr. Oh, by the way, this one back here is called like a pencil burr or a hot dog burr. Hot dog diamond burr right there. And this one is a mosquito diamond burr. Mosquito because it looks like a mosquito's beak. But I use this to go through and reshape the fine corners of the tooth when I'm finishing the smile after the braces have been removed. There's that. And then when I'm removing cement, I'll either use a white stone to go through and do the final polish. This is a white stone burr right there. Or I'll use a green stone for the initial debridement and the gross debridement of all the cement off the tooth. I'll use this first usually, and then use a white stone to go through and do the fine polish, make the tooth nice and shiny. The other burrs I have here are called carbide burrs. They're just a metal cone or whatever shape you want. You can get a cone or a football shape right here. It's football carbide right like that. Or you can get like a pencil or hot dog carbide burr like that. They're not sharp, they're just a metal carbide surface there. And the more flutes they have, like the more edges they have on the burr. You can see this one or not. Maybe not. There you go. The more flutes you have on it, the finer and less aggressive the burr. There's that one. And then I just have different variations here. So this is an IPR strip. It's for doing IPR, but a more like a slower way to do it, more precise way. If I'm just trying to get a few little half a millimeter down, I'll use an IPR strip. Usually I do kind of use both the IPR strip and the IPR disc in tandem together. But yeah, that's that. Let's put these back in here real fast. The next thing I want to go over are the hand pieces. So we have different variations and different designs of the hand pieces. So I have, this is a slow speed. This little tube right here is for spraying water or air on the tooth whenever you're doing your thing. So I don't totally use it because it gets kind of messy, but it's there. You don't want to mess with it. If you don't connect it, it'll spray water everywhere. Here's your, down here, you can see little twist this over here a little bit and undo this actually. you can see a reverse, or an R right there, and then a forward right there, an F. This little like indicator circle right here tells you where the motor is set. Like you can adjust the speed, you can adjust the direction, you can have it reverse, you can have it go forward. But I only use it in full forward, so just leave it right there. That's the slow speed for you. And the next thing is the high speed handpiece. High speed meaning it'll turn the burr quickly, around 100,000 RPMs a minute, or a second, sorry. And then there's different variations. You have ones that will just click on, like this one has nothing to kind of connect to the chair. That little quick connect is already connected to the chair, so all I gotta do is pull the quick connect down and push this in, and you're good to go. To insert a handpiece, or to insert the burr, there's a little button right here. And what you want to do when you're doing that, it's right here. Whenever you put a burr on the handpiece, you want to make sure it's completely inserted inside the head. If it's not, it won't grab onto the burr, and when I push on the control panel, it'll just blow it out and blow it down the patient's throat. Bad day. So make sure you push the button in all the way, kind of with the heel of your knuckle right there. Push the burr all the way in. So push it down, then push the burr in like that. It should be buried like this. And then I may go through and adjust it and kind of bring it forward a little bit like that if I need to, but by and large, make sure it's inserted all the way. Kind of tug on it too, to make sure that it's not gonna blow out of the handpiece. There's that. And then we have the different attachments. We have plastic air spray or air water syringe tips. This is a metal one. I like using the metal ones just because it's sturdy and you can just clean it and you're good to go. Whenever you're putting those in, the handpiece or the actual controller of the air and water, I'll show you how to do that, but this is just the nozzle that goes into it. This little piece right here is breakable, so you don't want to break this little spot right there. Just make sure you don't insert it at a weird angle. Just insert it straight and it'll lock once it's in there. The next thing I want to do is show you a few things that we use in reties and tying things up. For orthodontics, we have, this is called a long ligature tie. And ligature is just something that ligates, so it's tying something together, a tooth. Usually I use these when I'm going to go through and tie the anterior 2-to-2 or whatever, or a canine, but this is a long steel tie, is what I usually call it. So a long steel tie. And I have different materials now. So we have, these are called micro brushes. These are little mini cotton padded brushes that I use to apply the materials to the tooth, usually a Sure or you can apply etch to it. Anything you want to apply to the tooth, you use this. I'd much rather waste these than to waste the material I'm placing. Like this stuff, for instance, like the Assure Plus is very expensive. You don't want to waste it. I'd rather just put a little dab of this on the toothbrush or on this micro brush's tip and use multiples of these than the alternative of dousing your glove or putting a puddle on your tray or something, because you waste that. So do not waste this stuff. It's called Assure Plus. It's the stuff that I use to bond the bracket to the tooth. This is very, very expensive. Don't waste it. But this is the micro brush. I'd rather waste these than to waste the Assure Plus. The next thing I have, I'll go over these material. So we have different suction tips. This is the high volume suction. It has two openings, one that's kind of got the one opening, and the other side has two openings. The reason why this portion right here is open, so as if you accidentally suck the tongue or the cheek, it's not gonna just plug the system. It can still suck up the water and not suck up the person's tongue or cheek. So whenever you're inserting the high volume suction, have this end available for the suction, not this end. So this is how that works. Here is the low volume suction. This is for gathering saliva if someone's got some saliva pooling up in the back of the throat. It has a little metal wire inside of it so you can bend it and it'll hold its shape. If you're trying to bond a bracket like on the 6s or 7s, usually I have this going, and after I've etched, to keep the tooth dry, I'll have the patient bite on this to suck the saliva out while you're working in that quadrant or in that area. So this is a low volume suction. Okay, and then this is a 2x2 gauze, 2 many inches. We got 2x2, a square gauze. We use these if the patient is bleeding, like if I am going through and debonding the patient and they've got blood on their gums. You don't have to wait for me to ask for the 2x2 gauze. If you see them bleeding all over the place, instead of watching me watch them bleed while I'm working, you can just reach in and grab one of these and give it to me so I can wipe up the blood. These are called dry angles. These are meant to go inside the cheek. Next to the upper second molars, there's a little papilla that spits out saliva, and so whenever we're putting braces on, these need to be on top, underneath the nola, and they go on both sides. And so you insert it with the pointy end going towards the throat. I kind of bend it like this a little bit, and then I insert it like that. So you 2 per patient, and make sure you always use these whenever you're using a nola. Here I have some materials. This is called power chain. There's different types, different colors. There's different linkages. This is called like an open chain, open power chain, because the little links, you may not be able to see that. The little links are spaced out. Usually this is good for like final end or final game or end of treatment closure, space closure, where I'm trying to just maintain that space closure is adequate. But with that space right there, if you put that on the bottom teeth, it'll actually reopen space because the teeth are closer than the actual power chain loops are. So I like to use power chain that's closed, where the loops are like this close, not like this. Like this is open power chain right here, closed like that. I prefer closed whenever possible, but if we have some open power chain, I'll use it. There's that. This is called power thread, or elastomeric thread. I use this when I'm pulling in canines, or if I'm doing like power chain on top, and then I'll make like a little colligation with power thread underneath the brackets. So you can see this. I use this when tying in power chain or canines and closing space that's being difficult. So power thread is what this is called. This is called open coil spring. Open coil because it's compressible. The coil is open, meaning like the little spaces, there's like a space between the little wedges. I don't know if you can see that or not. Anyway, it's compressible. And this is what I use to open up spaces. Whenever you're measuring how much coil to use, you typically want to go through and just go by bracket. So here's my bracket edge, here's my other bracket edge. You want to go a couple millimeters past the bracket. So I want to go through and add coil that goes from here, past here to here, a couple millimeters, and I'll draw that out. But this is just called open coil spring. Here for you. Yeah, it's called open coil spring right here. So I do have closed coil spring. I don't use that very much. The closed coil spring is not compressible. It's mainly for comfort or just space maintenance. So if there's a space I'm trying to hold open for some reason, I'll use closed coil spring instead of just leaving the bare wire there, because the bare wire can irritate the cheeks. This is a retainer wire. It's a gold wire. I use this for a cemented retainer on the lower 3-3. I don't do retainers on the upper arch because they break. They're not stable, but I do these on the bottom. That's what this is for. This is called a spacer. So I use this for making space for the bands to go through and position them, the bands on the tooth. So in order to do that, I've got to have some space first. So this is what I use that for. I've covered this. This is called a Sure. I'll kind of give you the sequence here. So I have Reliance Blue High Viscosity Etch. This is 35% phosphoric acid. So do not let this touch the patient's skin or their eyes. Every time you're using this, the patient must have eyewear, protective eyeglasses on at all times. I also just ask the patient to close their eyes when I'm spraying this off the tooth for added measure. In the event that this does get on someone's skin, do not ignore it. Do not leave it there, including the lips. It will burn a big hole and cause a big scar. So what you do is you gently wipe it off, and you take some water and spray, position the gauze like below the area you're trying to rinse off, and you're going to rinse the area that has the etch on the skin so that doesn't burn the skin. This is the etch, so you put that on the tooth first for about 30 to 60 seconds. Rinse it off, clean it all up, and then dry it. Make sure it's dry. You'll see the tooth is nice and frosty. And then you'll take a little drop of this and put it on a micro brush, and then you'll position the micro brush and gently kind of just let the Assure Plus, this material, this resin, kind of flood into the tooth. You don't want to scrub it on the tooth, that's bad. It'll break the little crystalline structure. And then the Reliance Go-To paste is the bracket cement that we use to get the brackets to adhere to the bracket and to this stuff. This is like the sequence. Whenever you're trying to put a bracket on, it's got to be etch, primer, and then glue. So there you go. And then two other materials here that are useful. This is called TKO. It is a light cure pink gel that I use for bite turbos. Easy to use. Comes in a little syringe like this. In order for it to stick to the tooth, you have to go through and etch and prime. Anytime you want something to stick to the tooth, you have to etch it and you have to prime it. So TKO. I also use this Ultra Band Lock. It's a blue cement. I use this for bite turbos when I'm out of this stuff. But really what it's used for is band lock, like cementing the band to the tooth. But it's got the tooth has to be dry, otherwise this can come loose. So I don't really like to use it unless I have to, but I do have both. And then I have, last but not least, I got a few things here. This is called an O-tie. These are basically like a power chain but not connected. This is how, if someone wants colors, that's what that means. Here we use Pitts brackets. They have doors on them, so we don't have to use colors. I prefer not to use colors, but they are there if someone wants them. This is floss. We use floss to go through and grab the spacers to insert, and I'll show you that technique later. And then this is mouth wax, so if someone has some sores on their mouth, they can go through and put some wax in the little areas that are bothering them, as long as they dry it first. And then I got some chapstick. We give chapstick, put some chapstick inside the bands before we put cement on, because then the cement can get in the bands tubes and clog it, and the band's worthless. And then just give that to the patient when they're done for their chapped lips. And then this is flowable resin. We use this when bonding retainers on the mouth. I don't use it a whole lot, but we still have that. So there you go.